Well, good morning, everybody, and welcome to this very special panel by Hikigai Studios. I am your host, Lalitha, the CEO of Hikigai, and I am super thrilled to be with all of you today on this Friday morning, Jan 30th. Is AI about to shatter the glass stethoscope? That's a big question for today. Or permanently digitalize it or digitize it? Today's context is just about that, and I am very happy we have the title just put together, reflecting that beyond the glass stethoscope for a reason. For decades, women in healthcare have faced a dual reality. On one hand, we are the backbone of the workforce holding the stethoscope. And on the other hand, we have often been invisible in the data, invisible in the boardroom, and invisible in the algorithms that drive care. So today, as our first kickoff podcast for Hikigai Studios, we're standing in a tipping point where we're talking about this concern to be addressed. And I'm very happy that we have some very capable and very able women with us today who are going to be handling this for me and giving some great insights on their understanding of beyond the glass stethoscope. So I'm going to be joined by a powerhouse, a panel of leaders who are not just watching this transformation, they're actually also driving it. We have Dr. Aditi Joshi, Dr. Viv Baber, Dr. Laura Cooley, and Dr. Samar also. And we will be starting off with some very interesting questions, and I'm going to call them all on board one by one. And thank you, ladies, for being here. I'm super excited. And we start off with our first question, which I'm going to have Aditi give me your perspective about this. So, Aditi, the glass stethoscope moment, our theme today, is moving beyond the glass stethoscope, right? Each of you have broken through traditional boundaries to work at its intersection of technology and care. What is that one pivotal moment in your specific career, whether in frontline medicine, pharma strategy, or behavior research, that convinced you that AI was the key to shattering those old ceilings?
Thanks, Lalitha, for having me and to the whole Hikigai team. And hello, ladies. Excited for our conversation. So I'll say that actually it wasn't AI that probably was that pivotal moment. I've been in health technology for about 13 years, and my journey started with telemedicine. And I got into it because I was really burnt out in the emergency department. I'm an emergency medicine physician. And so I was looking for other avenues. And it was interesting because once I got into that space of technology, this connection using technology to connect two parties, which is what telemedicine is, whether it's phone, video, you realize that it can solve some of the problems that we see throughout our healthcare system and some of the reasons that I got burnout or what we call moral injury in medicine, where there were access issues. You could see the discrepancies, the way that some people are treated, and they just didn't feel like they were really getting great care, the financial pressures, all of those things. So just to say that that's what started my journey. And AI for me is a little bit newer. And the way that I see that it is being interpreted by me is really how do I use it in virtual care to do some of those same things? So for me, it was a burnout story. It's very classic, trying to do something new and try to add something to my emergency medicine career that could really help some of the problems that I was seeing. And, as we get further in this conversation, I will say that AI, like every single tool out there, can be used to break this glass stethoscope, but it can also cause a lot of problems. And so it's really important to have these discussions with women and get women in this field and to get them in the discussion. So really glad to be here for that.
Thank you so much, Aditi. That's a great start and a wonderful response. And I must commend how you were able to kind of reflect that purely on where you come from in your space. So thank you so much for that. So Laura, you would definitely have your own perspective through your glasses, I must say, and give me an answer for this. And, I would love to hear your perspective about this.
I think what has most compelled me to think about AI as an opportunity is that I'm someone who's trained with a PhD in communication science, and I've mostly focused on the patient-clinician relationship and how communication helps us build trust, earn trust, actually. And I think some of our deepest gaps in healthcare are not really a lack of capacity or desire. It's that we have a scarcity of time, a scarcity of attention, and our emotional bandwidth can be really depleted. And my hope is that AI can relieve some of those time consuming tasks and enable us to redirect that time to focus on human connection and what I view as the truly therapeutic relationships that matter in healthcare. AI can be leveraged to reduce things like documentation burden or cognitive overload. And you may have heard me mentioning this before, but one of my goals is to advocate for a second definition of the term AI as authentic interaction, a way
Mm.
to protect our relational core of human care and acknowledge the tensions with the complexity of technology and stay as human as possible.
Fantastic. So, authentic interaction is the key here. Okay. Thank you so much. And Huma, I'm sure you have a very, different perspective, especially now being with VA and in the cardiology field and your specialty. Would love to hear your perspective on this, please.
Firstly, thanks so much for having me here, Lalita, with all these wonderful ladies to talk about such an important topic. So you're right, my perspective is a little bit different. So I'm a cardiologist, but I specialize in cardiac imaging. So what I do is sort of at the intersection of cardiology and radiology. And as everyone knows, both of these two fields, especially radiology, really has been way ahead in this whole in this whole AI space. So that's where I got my exposure initially to AI, with using simple tools just for automation of manual tasks that was so cumbersome to do when we were, reading these images. But I think in terms of that pivotal moment that you talk about, I think for me, it was pivotal in the sense that I realized that I need to learn more about this. I need to educate myself more about this so I can use it in a useful way and also get the most out of it. And that happened, I think, when I realized that AI could be, in terms of interpretation of images, sort of the diagnostic part of AI, could really be at the level of an expert clinician. So it wasn't making an expert clinician a super expert, but it was really raising clinicians who may not be those level 3 experts in image interpretation, but helping them to get to that level 3 expert level when they interpret the images. And when you think about this, it can really democratize how we bring specialty care to all patients, where it's not confined within our large academic centers that have these specialists, but taking this knowledge and making it available everywhere. So I think that was the moment for me that I felt, no, I really need to understand this better to use it to its full capacity.
Excellent. And Huma, I think that was a very important point made. To be able to replicate that from one to another, I think that's the key here. So great insight. And Viv, you are our final person to give your perspective for this question. And I would love to hear your perspective, please.
Sure. First of all, thank you so much for having me. It's lovely being with everyone here today. And I come from more of the psychiatric background, so 20 plus years as a psychiatrist. So naturally, anything that's coming new, we always look at it as like a little bit of fear, resistance. How are we going to adapt to this? My pivotal moment, I think, came when I was exploring healthcare innovation. I was attending a lot of these pitch events to learn more about innovation in healthcare. And so naturally, that led me to understanding AI, because now every part of innovation, AI will be a part of it. Other than the piece of the efficiency that it's going to bring into the system, I was looking at it more from a governance angle. And prior to that, I did do some certifications in medicine ethics, AI ethics specifically, and also AI governance. And I received a certification outside of medicine through the International Association of Privacy Professionals. The reason I did that was to also understand AI from the IT cyber privacy perspective, not just the medical perspective. And that led me to learn more about AI governance, because healthcare is a high risk category. There's a lot of high other than high risk category, it's high trust. And so that leads to, more of how are physicians going to implement this in practice and what are the effects the patients are going to have. So as I started exploring that led me to, this is also going to open up a lot of opportunities for AI education, for AI governance professionals, AI advisory work, AI consulting. And I think this is an area where women can really leverage their leadership because we have that ability of that biopsychosocial intelligence to bring that balance back into that algorithm that might be biased or underrepresented. And so that's kind of my journey and where I see this going. And I think women we're going to be at the forefront leading this.
I love that, Viv. And I did read your white paper that you had spoken about, just what you had mentioned about governance, and very impressive and very reflective of what you had to share today. So, ladies, thank you so much. I think that was a great head start. So now we're moving on to architects versus participants, right? As leaders, we come across different facets of the ecosystem. And how have you seen the influence of women in specific evolve from merely just participating in health tech adoption to actively architecting its strategy, ethics, and the deployment, all the way from the start to the end? And, I'd love to hear your perspective on that. So we'll start off with Aditi.
Yeah, thank you for this question. Well, first I want to level set and say that when we talk about the ecosystem in general, we have to recognize that in general, it's not a level playing field, right? Women have historically not been in the room for any decision making. Many have left academics or they leave large practices because they don't feel like they're able to get promotions. Many, many people have researched it, people who have done a lot of more work and writing on this than I have. But when you look into it, right, we still see those patterns emerging, and I think they're still out there. But when I look at health tech in general, I will say that when I started, I can tell very clearly that when I joined ASEP and their telehealth committee, in the leadership committee, I was the only woman for a few years. And now it is full of women. We have, a lot of architects, strategy. But I want to also make clear that it was interesting that it became much more like that once telehealth became more ubiquitous. Unfortunately, I have to say that what I see out in the AI world, it is still predominantly men making those decisions and making that architecture. So while I would love to say that this has changed dramatically, I see the same pattern emerging. And it's not to say that it doesn't exist. There are incredible women out there. Look at all of you working in this space, people doing machine learning, governance. There are a lot of CEOs or chief medical officers, people who are doing the work. But I will say that the ugly truth is you talk to a lot of them, sometimes they don't feel like their voice is heard. And so that is the grim reality that I just want to bring up and say that I don't know what the solution is, except for a system-wide overhaul in the way that we think, to have these discussions openly and to get our, men colleagues part of this discussion and change as well.
That is phenomenal. So yes, I can totally kind of relate to that, and I echo your words so very well. And we will all hold a banner and we'll keep talking about it. And more voices is definitely going to add the strength. And like you said, it slowly is steadily moving to bring some differences, but not there yet. I totally agree with you. So Laura, I would love to hear your perspective from the academic perspective also, and what's in the scene with research and with AI also.
So my perspective is a bit influenced. I think that women do have a big opportunity as AI architects. As the editor-in-chief for an academic journal, the Journal of Patient Experience, I get the opportunity to work with a lot of really smart women for many reasons. I think women have gravitated toward the field of patient experience. So we actually see a lot of female leadership in that particular domain, which we don't really see in healthcare tech and artificial intelligence adoptions and architecture. So I'm excited about how women can lean in to the artificial intelligence space as thoughtful influencers and creative implementers. And I think that importantly, I view ourselves as female leaders having the opportunity to ask questions a bit differently than the industry has historically. Some of the questions I go around asking, for example, is how does this tool improve relationships, not just efficiency? Who might be helped versus harmed with the implementation of a particular AI tool? How have we invited patients and families into the architecture of AI in healthcare? And how can AI enable us to build trust with patients, and especially those who are historically marginalized? So I invite us all to ask more thoughtful, provocative questions that enable authentic interactions.
Phenomenal. And that certainly kind of reflects a lot about what Viv was talking about, the socio, empathy and all of that factors. Certainly, I mean, we've seen this with evolution that women have those qualities, and that's very important. And we still have predominantly seen the caretaking people, the nurses and the frontline people are the women who are, providing that space. So great, wonderful, wonderful perspective and very positive indeed. I love that we're directed and looking at a very optimistic lens in that. And so now I would like Huma to tell me what she thinks or what you think about it from your space, especially in cardiology, from start to end. Have you seen the differences? Are you seeing it, or is it still the same?
No, I think I definitely am seeing differences. So I agree with you and Aditi that, women's representation and leadership clearly is nowhere near what it should be. But we are making that slow progress. And I think there was a recent McKinsey report that said that I think we're now up to like 35% women representation in all C-suite roles together, which was like 30% just a few years ago. So I think we're very slowly inching in the right direction. And I think some of those roles, at least what I'm seeing or reading about, are these roles of chief innovation officer. And then, the more sort of recent addition to the C-suite roles, which is the chief AI officer. And there are some very powerful women who are in these roles in large academic centers. And that's sort of making this top-down change and how AI is going to be implemented and how its risks are going to be addressed. But very interestingly, what I'm seeing at my institution is a very bottom-up approach as well. I'm seeing a lot of women who are really taking the initiative in making sure they go out, they understand how AI works, how do these tools work, what again are the good and the bad things about them, and then they're taking it upon themselves to educate their colleagues. They're having like lunchtime sessions. Okay, do you know how this tool works? Honestly, 9 out of 10 times the answer is no. And they're like, okay, let's meet at lunch and let me, because I've used it, I know a little bit about it. Let me tell you how it works. Let me tell you what are the shortcuts to use to make your life easier. I see a lot of this happening, and even in my institution. And this initiative that they're taking is clearly getting them noticed. It's, they're now finding themselves a lot on these committees, whether it's the informatics committee or the AI committees of the hospitals and the networks and so on. And I think it's clearly making a difference in getting their voices heard.
That's phenomenal. So the sharing and caring is happening very actively, I see,
Absolutely.
which certainly kind of reflects on the empathy factors too. So that's great. So you would be our final person to give me your perspective about this, and I'm sure you would have your own dialogue to deliver.
Sure. I'd like to start off with saying that I think often we underestimate ourselves. Women generally underestimate themselves. They're capable of a lot more. And so I wanted to start with that. And a couple of years ago, I also came across a few statistics that were kind of a little disheartening, because I heard that only 22% of professional women use AI in the workplace, and only about 15% of executive women are using AI for strategy in their workplace. And so this is across the board, not specifically for medicine. So, I kind of explored what's going on behind this, because I think initially when AI first presented itself out there publicly, more common, and everybody knew about AI or thought they knew about AI, it was more seen as a technology or software. It wasn't seen as something we're going to use on a daily basis down the road in the future of the workplace. And so that created some fear and resistance. Women tended to shy away from new technologies just over the years, if you watch the patterns and things like that. So So then I explored a little more beyond that, and across the board, I would say organizations are still lacking in AI literacy and AI fluency. And what I mean by that is people are still not clear what AI exactly is, the terminology, what are the policies in the workplace, how am I going to use this, how is this going to affect me, is this going to take my job? That fear creeps up. And so people build a resistance or anxiety towards that. The fluency piece of it is that now that we know what it is, if we have learned that, how is this going to affect our day-to-day workflow, right? And so, because this is the biggest elephant in the room I've seen across organizations, it's also the one that's the most, I would say, lacking in focus and attention. This is where we need to start in healthcare and other organizations. I mean, across the board, like I said, across the industries, it's very common. There's no proper training being given. And so education is very important in this space, not only from medical school, but practicing clinicians, CMEs. We need to bring it down to the basics and the foundation. Once we can start with that, then people feel more comfortable to use it. And if we can also encourage more women to step up, like these ladies have mentioned, as AI champions, whether it's in a little, just even if it's a work group or going to lunch and collaborating, I think that's helping quite a bit. And that's where I think generations of women have been going, is that collective collaboration, communication that we really need. And that's what's going to push us forward. But we need to start with the basics first as the foundation.
Yeah, collaboration is the key here, and we definitely do great when we are the strength increases, and adding value there is definitely more than. So I'm going to kind of change the scene here and skip a few about what I was thinking I would answer, but I really would like to get to the basis of looking at the data gap in women's health. So we have a phenomenal team here who's addressing different concerns. But looking at the actual healthcare space and how that's addressing women's health, this is another new, problem that we are trying to solve and resolve. So closing the data gap in women's health, with women's health being historically under-researched and data being still poor, how can we specifically leverage AI's ability to handle those complex data sets and also finally close the knowledge gap, which hopefully happens pretty soon, and also that we are seeing enough strategic focus moving in that direction today. So Aditi, please, if you have your perspective for that, would love to hear it.
Just thinking about a couple of things too, just based on what some of the others say, what I think is really important to stress when we think about this is two things. One, there is still a huge opportunity in AI. Now, we're talking about it. It seems like it's everywhere, but the reality is there's still a lot of work to do. So anybody who wants to be a leader, who wants to get into strategy, there's a huge opportunity to still do so. And then second, it's when we think about it and the way that it works within health technology, AI itself is not really its own technology by itself, not the tech portion. That's not what I mean, but the way that it's used, right? It's actually used to power other things. So in the case of imaging, right, you have the images and then it may be being used to feed through to look for diagnoses, to look for rhythms that are abnormal, whatever it is, depending on the specialty. In emergency medicine or in telehealth, for example, it is powering how we might be triaging. It might be looking at patterns and diagnoses. So when you think of it that way, and you ask about how do we use it within women's health, the reality is then it fits in perfectly, right? Because we are in this gap of research and data. So at the moment, we still have a lot of research to do to fix that gap. So unfortunately, what we've already fed into the algorithm is vastly under appreciating and underutilizing the data that we need. But because we have now all these other health tech tools, we have wearables, devices, we have electronic medical records, that AI can actually power and take women's data and women's health data and actually be fed and do better research much faster than we would have been able to do without it. And so it's an incredible thing. But of course, as we all know, we have to also make sure that it's pulling the right data, right? Because we all know that as researchers or when you're reading research papers, sometimes the data can be a not skewed. I don't want to say it that way, but it can be interpreted in a couple of different ways. And we have to be really careful when we do that. And obviously, with an AI algorithm, that can be exponential. But I think there's a lot of opportunity and hope to get this done faster than we could have without it.
Excellent, excellent. And yes, you're so right about that. Any underrepresented community would have that issue and bias. So that holds for any of the minorities also, including women we're talking in specific here. So Laura, I'm sure you have a very different approach to this from where you're talking about it in the research aspects. I would love to hear your take on this, please.
When I think about the opportunity with the data gap in women's health and how AI can help with that, I think we have an important tension to hold because right now we're seeing a lot of adoption of ambient listening, AI scribes. So clinicians are being equipped with less documentation burden, ideally, and that we have really accurate and detailed notes that can be captured. My understanding is that right now, those tools are intentionally designed to remove personal stories or emotional, like personal context from the notes in some capacities. And what I hope is that our data can include some of the emotional domains, some of the personal stories that really make us human and that impact our health outcomes and whether or not we follow our treatment plans or what gets in the way or what we really need to be receiving personalized care. So I think that's a big thing I'm thinking about, and that I think we could be retraining our AI tools to look for data that speaks to the story, the emotion, and the person who we're providing care for in a much more focused way. And that's really one of my big hopes. And I also think we have obvious ways of looking for the symptoms that might be dismissed or normalized when it comes to women. We have a deep history of labeling women as more emotional or disregarding some of their health symptoms or concerns because there's a mental or emotional component revealed, and somehow that negates that data. And so I'm optimistic that as more women like all of you step into the AI space, we can make a difference.
Phenomenal. That's a very critical perspective that you've brought in, Laura. And I would now like to hear from our cardiologist, who's also probably engaging with a lot of women's hearts and looking at how we can keep them healthy. So onward to you, Hama, to hear about your perspective about this.
Yeah, Lalita, you're so right. For all of these decades, we've been treating women's cardiovascular disease based on trials that were done almost entirely on men. We've been using the same cutoffs for treatment. We've been using the same guidelines, and we are realizing that we've been wrong. We've tried to correct to some extent using body surface area and height metrics, but that's not the entire explanation, and that does not correct the differences. Women really are different from men. The disease behaves differently in women than it does in men. And there has now been a call to change our guidelines for cardiovascular diseases. We need to have different guidelines for men and women. This one size fits all clearly does not work. And now, if we really want to do that, do we really have to wait the same, 10 years to redo all of these trials from scratch? Can AI look at all the data that we already have from our previous trials, from simulations, from synthetic data, to help us get there sooner so we understand what should be the right guidelines and cutoffs for treating women in all different aspects of cardiovascular disease, so we don't use these one-size-fits-all approach for all our patients.
Wow. Yeah. The some of the legacy data needs to probably be scrapped. And you're right. Simulation probably is one of the ways that we could probably add value here. And I would love to hear from Viv about this because I know her book also had some aspects of this. But yeah, Viv, over to you, please.
Sure. Other than AI focusing and helping us uncover what's missing, what's underrepresented of at least the women population, we already know that. All the ladies have chimed in on that, and I agree. We're just pretty much way off, when we look at the data for women. So I would say we would need to start with, first of all, the data integrity and equity, meaning we need to keep an eye on the data. How is it coming through? Who's responsible? Because that matters too. Who's accountable? Who's responsible? Are women involved in this data collection process, reviewing the data, cleaning the data, training the data? Is it valid? All these questions come up. And so there has to be sort of, like I said, keeping eyes on the data as it travels. Where does it originate? Who's responsible for that? If something's going wrong, who's going to take care of it? What's the escalation step? Where is it being sourced? The biases. I could go on about this, but just for the sake of this interview, basically, we need to make sure that equity only advances the fastest when there's responsibility is clear and accountable. And so that's where women can come into this role at different steps or stages to keep an eye on the data. It's important for us to be involved. It's representing us, so we need to be a part of it, and we need to be in the picture to train that data too.
Yeah. So I think also, Viv, if I could add just the epidemiological studies, which has bigger numbers, the Framingham studies, or the ones that actually will truly represent a bigger population, are the ones we probably need to bring into the idea. So that's a great point made. Thank you so much. Okay, ladies, I know we are not allowed to be here for the whole day, but I would love to carry on this discussion. But I have a few more, and this one is the rapid round, or the lightning round is what we call it. So this is more domain specific, all right? And it's tailored to your specific expertise. So what is that one single most promising AI application you're tracking right now in your corner of your industry? And be it in emergency medicine, be it in life sciences, commercialization, or patient communication. What is that one thing? And Aditi, please, over to you.
Yeah, so I'll answer this actually from both an emergency medicine and telemedicine perspective because it's essentially the same, especially because I do acute care telemedicine, but it's really triaging, getting the patient to the right place. What ends up happening in the way it works now, we do a lot of surveys, which can be wrong, or people come to a telemedicine appointment, or they go into the ER and wait for hours when they might have been able to go somewhere else. And so it would be really exciting to watch how maybe AI can do this safely. I will say that not one ER doctor anywhere is trusting it 100%. We're not doing that, but I find that that would be a huge value add as we have an aging population. We have a bigger population going into the ER. We have people in geographical areas that are not near emergency departments, or even just need care over virtual care. So I would find that to be the biggest exciting phase, just as a practical day to day. And then, of course, the addition of having more information at our fingertips, that would be exciting too.
Awesome. Awesome. And Laura, what's your take on this?
I have to lean into my expertise in patient experience and communication skills as a key driver of the experience outcomes we see. I'm still really excited about ambient listening, even though there are some trust issues that it's still at play, because I think we can train our ambient listening tools and the other tools that our clinicians are using in their encounters with patients to help clinicians listen more attentively without the burden of typing or turning their bodies away, engaging in more eye contact and noticing facial cues and body language because they are able to be more present. I also think we have a huge opportunity with improving communication by training the tools to reflect those emotional cues and the patient stories and capture those things in a documented way where they can be referenced back to by the next clinician or the same clinician again. And for me, I'm full of hope that our AI tools can help our clinicians be more authentic in their interactions and more connected as humans, which is good for burnout and good for our patient experience and our patient outcomes.
Awesome. Awesome. Great point made about the ambient listening and the AI scribe. That's definitely, that was the buzzword for 2025, if I may say so. And that's kind of still the tip of the iceberg, but we're getting there. So thank you, Laura. And Viv, Hama, I would love to hear your perspective here especially from your expertise of cardiology?
Yeah, there is a lot of exciting things happening both in cardiology and in radiology, but to narrow it down to just one to answer your question, there is something that's starting to take shape in radiology with what's called vision language models now, where we are not just using all these point solutions for diagnosing specific conditions and using a different large language model to generate reports, but having this one integrated model that will do both in a seamless manner. Now, obviously, this is really in its infancy right now, but something very exciting to watch out for.
Awesome. Awesome. That is definitely exciting to hear and watch out for. So we'll keep an eye to, being updated about that. And Viv, what's your take here? What is that
I
one
agree.
tool?
Oh, yes, I agree with all three. The navigation part of things, of the scheduling and the kind of cutting down the paperwork time, which I think takes a lot out of us. And, it's that constant, that overload that we tend to feel with documentation and making sure we're getting everything that the patient has said or needed. And that pressure, getting that time back so we have that patient interaction time where we're actually facing them and talking to them. That's what I'm excited about. However, I do have to say I would proceed with a little bit of caution when it comes to our field of psychiatry, only because there are sensitive issues that might also come up. And I think for those special cases that we have what I would call, I don't know if it's out there or not, but I'm going to put it out there and give people some ideas to create and think about this, is for those sensitive issues, topics where confidentiality is very important. There could be history of trauma or abuse, and patients may not feel always comfortable being recorded or documented. It's sometimes hard enough for them to even open up to a human, much less, AI around the room or in their charts or, somebody else listening or somebody else has access to. I would highly suggest, if it's not already out there, to designate in every clinic or hospital a room that's considered an AI-free zone for those patients.
Wow, that's so important. And then some of the things that kind of just get buried, not knowing how to address this unless we actually speak to an expert like you. So important. Definitely an important point made, and we will certainly highlight on that, Viv. So this brings us to our future reality, right? You women are just so dynamic and so versatile with all of what you have shared about your insights. Looking at 5 to 10 years from now, ahead, what is it once we have actually turned and moved beyond the glass stethoscope, our title for today, right? What does that new day-to-day reality look like for a female clinician or a health tech leader operating in a fully AI integrated system? This is utopia world for us now, but very soon it's going to be reality. So Aditi, over to you.
What I would love to see, I think it's already happening. It's giving a lot more freedom for all physicians and clinicians to actually build practices that they want to be part of. We talked a lot about how the system may not serve certain populations or they're not able to see patients in the way that they want. And I think with AI as a tool, it's giving a lot more freedom, a lot more confidence, a lot more ability to actually set that up. And I've seen so many people just do that for themselves. Or on the other hand, they can also just do things on the side that might be important to them, but it takes a lot of time or they just don't have the bandwidth for. So maybe it's advocacy or working on governance or becoming involved in a charity, whatever it is that's really important to them. And so I see that it's going to be able to take away, I think it was Viv who said this earlier, we have more time to do the other things instead of having to do all of the day to day. We have more time to do some of these bigger projects because our day to day is helped out a lot more.
Awesome. Awesome. And Laura, what's your take here? What do you see as the future?
When I think about the future of health and care and how AI is obviously changing that, I'm mostly optimistic, and I think all of us in the room have named some important tensions that we have to hold, such as trust and privacy and safety. I want to imagine AI as a tool for empowerment in the future, and I think that will be true as long as thoughtful people like all of you are ensuring that that happens, that it becomes a tool for empowerment and human support and human connection. And I think the last thing I'm hopeful for is that we do have a capacity issue, in terms of how many patients we can care for and what that looks like in the future. And so I think AI tools are going to help people take care of themselves and have more knowledge and awareness as we get those tools more accurately and safely trained to provide that level of support in our homes rather than in our clinics.
Okay, great. Yeah, empowerment is a key word here. Awesome. Hama, your perspective on what you see as the future.
Yeah, I definitely agree with, Aditi and Laura both that I really hope that AI is going to make a lot of things easier. But the most important thing that I see currently that I really wish we could improve sooner rather than later is the amount of friction that we have in our healthcare system. And having so many of these different AI tools, I think is increasing that friction to an extent. It's not really helping to smooth it out. So my vision is true interoperability, where things really are talked to each other seamlessly. We are not jumping from screen to screen to screen to get one visit done or finish reading one study and inform the ordering clinician and so on. Something that truly is seamless, that not only saves time, but also has important implications for patient safety when it is, not fragmented and broken up like that. That's really my hope.
Well, let's hope for the best. And Viv, your take, please. What do you see as the
Sure.
future?
I would like, my hope for the future is that we've learned to manage AI and we've learned to be leading AI, and we should be leading AI versus AI leading us, which is what's going on right now with the whom I'm mentioning about the tools that are coming at us. It's that hyper adoption cycle we get thrown into, which is going to lead to AI decision fatigue or AI burnout. But I think if we've learned, hopefully in the next 5 to 10 years, to use AI as our partner and as an assistant versus something that's going to be controlling us, I think we're going to be much further ahead. And as we all know, the whole idea of bringing AI into the picture really is just for us to start feeling human again.
Absolutely. Yes. And I was itching to kind of give my 2 cents here, is that if you're able to see healthcare becoming more proactive versus more reactive as it is today, I think that's the biggest change, which kind of reflects on the human part of it and make it more human and available to the human beings as healthcare is. If we're able to do that with AI, I think we're definitely going in the right direction. And like you said, if you could have the human walk ahead and the robot walk behind holding hands, I think that's the ideal picture we should see for the future. So ladies, as much as I'm excited to have you guys in this forum, it's probably the time to wish our goodbyes. And I am going to ask you that one last question. I'm going a little off the chart, but I'm going to not put you on the spot, but there's one word that you would probably think of. And I'm just going to give you a few minutes for this, because this is not something that we had discussed before, but just off the chart. That's one word that you would think of that AI is bringing in today for us to make healthcare more human. What would that be? And each of you give your own one word for me, please. And we'll wrap up with that. So if it means that you need to take a few minutes, please do. We're perfectly all right with that. And so Aditi, whenever you're ready.
I'll go with transformation because it's a big word. I know we are talking about how does it make it more human, but I do think that we are always transforming, we're always changing, and it is going to be doing that in a significant way.
Love it. Transformation it is. Okay, Laura.
Authenticity.
Fantastic.
Perhaps the counterbalance to artificial, I think authentic interactions can be the partner for AI. And I'm going to keep charging towards that.
I love the opposite that you brought that in. That's a beautiful perspective. Authenticity. Okay. All right. Hama, what is your word? One word.
Assistive. I think it's really here to help us out. Of course, not take over our jobs. I think we're past that right now. I don't think anybody is thinking about that, but it's really here to help us. So like Viv said, we have to take the lead and make sure it helps us out in the way that's right for us and right for our patients.
Awesome. All right. Viv, it's your turn. The final word.
I'm
and
going to
please,
stick to the same word I've been saying about AI is efficiency.
efficiency. Okay. Efficiency.
Bottom line, it's helping us do things quicker, faster, but we still have to keep an eye on it. So that's where the governance piece comes in. But it's definitely going to make our lives hopefully much more efficient, so we get our time back.
Awesome. What a session. I mean, really, I must applaud all of you for coming over, showing up, first of all, and giving your time besides doing all the great things that you guys have been doing. And hats off to, our team, too, for making this happen. And I'm glad that it was all of you together in one forum. And I'm more excited about bringing you separately in other sessions. And I was just telling Hama that we want to have one exclusively for the Women Empower Month, which is March. And so if time permits, I would love to have you guys again for a panel discussion. So thank you all once again. And if there's any closing remarks that you would like to share, I would love to hear that. Aditi.
No, I would just say get involved. Like we said before, there's still a lot that can be done. Don't be scared of it. We are having all these tools at our fingertips. Don't be scared. Everything is doable and learnable.
Thank you, Aditi. Yes, Laura.
Hold the tension, artificial and authentic, not opposition.
Coming together. Okay, hold attention. All right. Okay, Hama.
Yeah, no, all I want to say was, thank you, Lalita, for doing this and for taking such a different take on AI and your glass stethoscope analogy. We don't really, at least I had not thought of it in that respect until I saw your memo go out. So yeah, thank you for bringing that to light.
Thank you very much. Appreciate that. Yes, and Viv.
Just want to remind every woman out there, don't underestimate your power. This is a time where women must lead AI.
Super. Awesome. Thank you, ladies, once again. And I look forward to bringing this on screen for all of you very soon. Thanks for your time and have a phenomenal day ahead.
Thank you.
Thank you.